Hi, everyone. I want to talk about one other condition that may be very closely linked to metabolic syndrome, and I believe probably closely linked to MCAS. I'm trying to work out the connections, but right now I feel very compelled to at least share with you some information so that we can all start thinking more about it, testing, and then eventually publishing, treating, right? There's lots of reasons for me to do this. It's because I just can't, this can't be a secret, right? So we're going to talk about a interesting gene called PAI-1 Polymorphism. It's the plasminogen activating inhibitor 1 gene that controls the production of plasminogen inhibitor, and the mutation, if you carry it, the 5G, so if you get 5G from both sides of the family, is normal, but what we're seeing a lot of is the heterozygous form 4G with a 5G. If you carry one of the 4Gs, it increases risk of clots and increases the risk of cardiovascular disease, cerebrovascular disease like strokes, and may be associated from some studies that I reviewed with metabolic syndrome and other inflammatory conditions like that, and may very well be linked to some of the long COVID things that we are seeing in some patients. So I've started to test patients more regularly for this genetic mutation. And when we find it, we have to have a conversation about how to deal with the risk for increased clotting. Everyone is different, so I am not giving advice at all. I do use some systemic, we'll call them systemic enzymes. Bulaki or lumbrokinase is one. I have a product, Optimum Natto Plus, which is nattokinase with serrapeptidase. They may be helpful. I think some patients are going to need more aggressive, we'll call it anticoagulation, more aggressive. This mutation basically affects the breakdown of fibrin, and then fibrin collects and basically makes the blood vessels full of stuff where the blood has a harder time circulating. So we want to break down fibrin. So you could theoretically trial things that are natural that could help with breaking it down. There are some more aggressive protocols using aspirin in combination with other blood thinners. Again, I'm not saying that anyone should do that, but I think that especially if you have had, let's say, COVID and you are not getting better, and you know you have MCAS or you have metabolic syndrome, you have the elevated hemoglobin A1C, and you still don't have answers. It's not just the diet, right? You figured out that the diet is pristine, but something else is causing this sort of inflammatory state. Keep looking, right? And I say this all the time, so I don't want to sound like a broken record, but I want to keep looking, and I want to understand, could it be even a fibrin issue in the blood vessels that's affecting circulation, then is causing many of the symptoms that we're seeing. So, food for thought. I'll have more as I dig deeper into this, but I wanted to share with you all today. Thank you.